Hello and welcome to today's episode of the White Butterfly Effect podcast. Today we are joined by the amazing Dr. Emma McCaskill, who is a GP but also a mummy, and a mummy who has walked the journey of recurrent pregnancy loss. So, hi Emma.
Hello.
Emma, could I just get you to start with introducing yourself a wee bit about who you are, what your background is, and then we'll maybe start to talk a wee bit about your pregnancies and just life since then.
Sure thing. Thank you for having me. I'm Emma. I am 39 and 3/4. And
that 3/4 is really important,
very important.
Emma. Very important.
And I am very grateful to be a mummy of 2 girls, Katie, 3, and Sophie, who is 5 months. And unfortunately, I had 2 first trimester miscarriages before I got pregnant with Katie. And then had a further one between Katie and Sophie. So, yes, I've been there, unfortunately.
Okay, so can we talk about your first pregnancy? Mm-hmm. And I suppose that moment of finding out you're pregnant, the excitement. Tell me about how that was. Well, I'm assuming there was excitement. Tell me how that was for you.
Yeah, so, I mean, me and Neil came pretty late to the game.
Neil's the husband?
Yeah,
okay.
Sorry. I think I was 35 when we decided to start trying for a family, and there was so much focus on the run-up to that in our profession. So we decided we'd moved home. We were living in Scotland. We moved back to Northern Ireland and thought, well, sure, why not? It all seems very naive now looking back at it. But got pregnant for the first time very quickly. That was December 2020. And just delighted. I think it took me by surprise how delighted I was to be pregnant because I was quite casual.
Yeah, if it happens, it happens. Not that bothered. Yeah.
Exactly. I think as soon as I saw that positive pregnancy test, I started thinking, I can't wait to get my bump. I can't wait to, do this and that and get my scans and just all the normal stuff that normal women experience when they're pregnant. And everything seemed to truck on fine, and I had a very, very early scan at about 5 or 6 weeks privately, and there was a heartbeat, all grand.
And was that, sorry Emma for interrupting you, but that scan, was that just out of pure excitement?
Yeah.
You just wanted to see?
Yeah. Wanted to think, is this real? Is this actually
I need somebody
happening?
to tell me,
So that was lovely. And then I just carried on, and I'd actually booked another private scan for about 11 weeks, just actually the week before my NHS scan, because I wanted to get some genetic screening done and another wee look. And a couple of days before that scan, I was running about at work. I worked in urgent care at the time, and I felt a bit funny, and I went to the loo and there was blood, and I kind of was like, oh, but then had a full shift to do, so just put it to the back of my mind, and it didn't really come to anything, but I was definitely a bit worried about it. And then the following day was scan day, and I woke up and it had got heavier and had quite a bit of pain by that stage, so I still went to the scan, and as soon as I walked into the scan room, just burst into tears. I said, I think I'm having a miscarriage. And God, the sonographer was so lovely. But unfortunately, she confirmed that there was no heartbeat. And by this stage, I was about 11 weeks dates. Yeah. And the pregnancy was only 7 weeks. And I just couldn't believe that I'd spent weeks thinking I was still pregnant when I wasn't. I felt really stupid, but I was just devastated. And she said, I'm going to phone your local early pregnancy. They will be in touch. Just go home for now. So I went home, and despite being a doctor, and a doctor who'd done quite a lot of women's health in her training, really didn't know what to expect physically. So I went home. I waited for this call, waited, and no call came, and pain escalated beyond what I was expecting. Bleeding, the same thing. Neil is a doctor too, and we were both thinking, so we're going to have to go to A&E. Like, it was really frightening. And then eventually I phoned early pregnancy and somebody phoned me back, by which stage things had come to a conclusion essentially at home, and everything was easing off, and they said, no, that's pretty normal. And I was like,
Normal.
In what way is a woman experiencing severe pain and bleeding at home alone with no support whatsoever normal? But anyway.
Yeah, like not even just the physical side of that. Like the physical side obviously was horrendous, but the mental side of that, like what is normal about that, like you say. And Emma, you've said something there which I think for a lot of the parents who will be listening to this, it'll be really probably very helpful for them. You're a doctor and your husband's a doctor, and you both didn't know. You didn't know what to do, and we're not educated enough. Like this is, me and you have had this conversation before, where the education around this is not like it's not enough. I know whenever we had lost our wee boy, I was told it would be like period pains. Now,
I mean, I've never had a period like that.
No, nor me. Like, and so I had to go in after 3 days to deliver him, and I actually said to the nurse at the time, I would not like to be having your periods, because there is nothing about that was like period pain.
No.
So it is horrific. And I think, because society has us almost believing, it's one of them things or whatever, we don't feel that we have the right to question what's happening or to be in that severe pain. And I think by somebody like you, who is obviously medically trained, coming out and saying, we didn't know what to expect. No. I think that's really helpful.
It was physically a shocking experience, and emotionally, I think when you're going through it physically, you focus on getting through that particular point, and then the emotional fallout afterwards again was just something I was not expecting whatsoever. I've never felt more completely empty emotionally and physically in my life. I was devastated, because although I knew it was common, I never thought it would be me. It sounds so weird and silly, but for me that was something that happened to other people,
100%,
to patients, not to me. So that, but early pregnancy followed me up and confirmed everything was, done, for want of a better word. And I was given a couple of leaflets and told to try again after your next period, And
that's just heartbreaking, isn't it? Like you're in that moment, whenever you're given the leaflets, we know that people mean the best, like they mean the best, but really to make a phone call to somebody at that point is very, very difficult. Like, which is why I think with the White Butterfly Foundation, we have a process in place with healthcare professionals where actually they can refer into us and me or someone else contact the patient, rather than the patient having to make that phone call. And you know what? If they're not ready to answer that message or that email, that's okay. But they know we're there. If it's needed. You know?
But thankfully, the hospital did cancel my booking appointment and stuff, so I didn't have that time, so I didn't have to do it. But so I duly did as they said. I went back to work. I got pregnant after my next period very quickly, and tried, and that was very different that time round. No excitement. I
was going to say, in that first, when we were first talking there about the scans, we very quickly went from the delight, the excitement of scans to scans becoming something that were terrifying.
Oh, yeah. I mean, I can't even think about going for a pregnancy scan now without getting the heebie-jeebies. Even now, 4 years on.
It's that moment where you're holding and you literally do hold your breath. And you just don't know what's going to come. And then if you're lucky enough, you'll get the news that you want. But I see in that moment, if you have experienced bad news at a scan, like literally is like your world is stopping.
It's awful.
Yeah.
It's awful. And I know we're going to talk about that maybe.
Yeah, we will.
It is, I mean, I wouldn't go back there if you paid me.
No.
Um,
So, second pregnancy. So you got pregnant again quite quickly.
Yeah.
And that experience then was very different.
Really different. I mean, full of anxiety from the get-go. I actually had a gut feeling that it wasn't going to work again. I don't know why, but I just could not buy into it in the same way at all. Maybe that was just a protective thing, but I got pregnant, had a bleed quite early on and went to early pregnancy, and they scanned me and there was a heartbeat, told me everything looks okay, and put me on progesterone. And said, well, just cross your fingers, see how it goes. And I booked another private scan a couple of weeks later, just for reassurance. Yeah. It might not have even been 2 weeks, I don't know. And went along, and it was a consultant doing this scan, and hopped up, told him what had happened, that I'd had a previous miscarriage, was very anxious, hopped up on the couch, and he popped the scanner in, as you do, and he was like, oh, okay, like everything's fine. And I was like, oh, great. And he was like, oh, no, wait. And my heart nearly fell out of my bum, sorry for the phrase, but it really did. And he said, no, I thought I saw a heartbeat, but it's Emma. Actually the heartbeat is really, really slow. So it had become, and he said, and this pregnancy isn't going to be viable. It's not going to progress. So, I mean, what do you say about that? It was horrible to be back there again.
Especially in that moment whenever your hopes were like, oh yes, this is okay, everything's fine, get myself organised, and then, oh no.
It was really difficult, and I actually felt a bit sorry for him.
Yeah, of course.
Because, we're human, and he did see a flicker of a heartbeat and was probably so keen to tell me everything was okay, to allay my anxieties, but maybe just make the judgment call a wee bit too soon. But he said, look, we're going to have to scan you again in a week. Can't do anything at the minute. And so it was at that point I actually reached out to the Recurrent Miscarriage Clinic, and ended up then getting followed up and seen by them, scanned about a week later, and confirmed that the pregnancy had ended, unfortunately, again, and had medical management that time, given some tablets to take at home. And that was a bit of an easier experience physically.
Okay.
I knew what to expect.
Yeah.
I was prepared. It wasn't quite as awful.
Yeah. But still awful.
Still awful, of course. And like nothing prepares you for having a miscarry at home.
No.
But I felt looked after that time by the professionals who were involved with me. The nurse on the ward phoned me the next day just to review things, offered follow-up if I wanted it, and then I had clinic follow-up in place anyway. But,
That makes a huge difference, though, Emma, doesn't it? Like,
massive.
I attended a conference a few years ago, and one of the lines that was said was, medical professionals have a choice to be the hero or the villain in your miscarriage, being loss, neonatal death journey. And I absolutely can say there's people in my medical professionals in my journey that have been absolute heroes. Like the nurse that looked after me whenever I delivered Tori, incredible. She was incredible. And then my own GP, like we've talked about this in the past, my own GP, it was just horrific. It was awful, no support whatsoever. So I think, if there is medical professionals listening, it's important. And if they're listening, probably they're the converted anyway.
Yeah.
We're probably not reaching the right ones.
Yeah, absolutely.
But it is so important. Like, and I suppose from your point of view, Emma, with your medical head on, like, so when you were referred to the recurrent pregnancy loss clinic, that was a self-referral. Is that right? Yeah.
Yeah.
And they then, did they do tests, or did that process look like?
Yeah, so I think at that point the referral guidance had changed. So if you're 35 or over now, you can be referred after 2.
Yeah.
So I had blood tests done and a scan to make sure my womb looked normal, and they all came back normal. Yeah. Which, to be fair, the doctor looking after me had prepared me for. He said, look, at least half of women's tests will come back normal. And in my gut, I just knew they would be.
Yeah. And for you as a medical professional, is that helpful or is that really frustrating?
I think I was fairly neutral about it, although I look after so many patients with symptoms that you investigate and you don't find out the cause, and I really empathised with them at that point about that frustration. Yeah. You don't want to have anything wrong with you.
Yeah.
But if there's something wrong with you and you can do something about it, isn't that nice? You know, if there's something going wrong and there's nothing anyone can find to fix it, well, that's
extremely frustrating.
No man's land, really.
Yeah.
But I was expecting it, so I didn't feel a huge amount of disappointment, even though it would have been nice to have had something to explain it. And I think also the test being normal allowed me to fall back into a wee bit of self-blame there, which I think many, many women do when they're miscarrying. Maybe it's my age. It's because I'm a bit fat, maybe I should have lost weight before, maybe
I drank that coffee, I took a paracetamol,
I went on that run, I was running, I was training, and all of these things that it allows that self-blame to creep in.
And is there an added layer of that, Emma, with you, because you do know the medical system from the inside? Is there an added layer of questioning things because you know so much medically?
A wee bit. So I think being a patient when you're a doctor is awful.
It's probably awful for you and the doctor who has you. Yeah.
Yeah. Although I hope I'm not a bad patient, but maybe.
No, I'm sure you're not.
Yeah, I don't know. But it's difficult because you have to relinquish control, and you're not used to that. You're used to being in control. So that's the hard part. I think the easy part was I trusted the doctor looking after me implicitly, and I knew he was good at his job. So it was easy for me to relinquish control to him and say, I'm the patient. I am just a patient in this scenario, and not just a patient, but you know what I mean. I'm not a doctor involved in my care. Yeah. I'm a woman who's had 2 miscarriages and desperately wants to be pregnant and carry. So it was kind of easy.
Easy because of him. Easy because you now knew that you knew that you had the right people in your corner. Mm-hmm. I think from my experience that was something that lifted a massive weight off my shoulders. Huge. Like I'd went from a scenario where, like I said earlier, my GP was not very helpful at all, to finding someone who then was extremely helpful. Yeah. And I felt like, do you know what, if I get pregnant again, I'm going to be okay because I have these people in my corner.
No matter the outcome. And I think that's the race. I thought, if I get pregnant again and it doesn't work, I'll be okay. I'll be okay
because, and I think part of that, not that you're okay because you won't be devastated, because you will, but you would also know that if that was to happen again, you've somebody there that's going to do the tests and
hold you through it.
Yeah. It makes such a difference.
So important.
So, let's talk about scans.
Yeah.
We talked there earlier about the earlier scans in your first pregnancy. You couldn't wait. In fact, you booked 2 private ones before you got to your 12-week one. And that all changed very quickly. Tell me about scans.
Oh, I have a love-hate relationship. Yeah. I think I've had 5 pregnancies. In
5 years?
In 5 pregnancies in 4 years. Yeah. And I wouldn't have survived any of them without scans.
Yeah.
In terms of managing my anxiety levels. Yeah. But in that probably 48 hours before the scan, you know, the anxiety levels were extremely hard to rationalise and deal with. Probably TMI, the only time I've ever had irritable bowel syndrome was before a pregnancy
of
scan.
course. And that's very, very normal. We
Oh
hear
my
that
gosh,
a lot.
like never had it before, and that lasted because I got growth scans for both of my girls. That lasted right up until term. It didn't go away, even though I could feel them moving in me. That residual, it was probably a Pavlovian response almost, like that residual anxiety just didn't go away. But the early scans were, awful. Obviously, you know, the ones that did go right, there's huge relief.
Absolutely.
It's so short-lived.
Yeah. So tell me this, Emma, right? So we're now under the care of the Recurrent Pregnancy Loss team, and you got pregnant then with Katie. Am I correct? Yeah. How long were we talking there?
So I had my last miscarriage in the May, and I think I got pregnant. I found out I was pregnant with Katie in the July. Okay. So pretty soon again.
Pretty soon. And again, straight away, you were saying earlier you had this intuition in your second pregnancy that it wasn't going to end the way we wanted it to. How did you feel third time with Katie?
Extremely cautious hope. I don't know why.
Could it be because you're under the care of the Recurrent Pregnancy Loss team?
I think so.
And I think that's really important. It's important that medical professions know how important they are in this journey. Hugely important.
Hugely. And I'd read the literature, and I know that women who are under the care of a good recurrent pregnancy clinic, pregnancy loss clinic, have higher rates of live births whether they have any treatment or not. The
psychological side of it.
It must be. I don't know what it is, but so cautious hope, but also just awful anxiety. I mean, my anxiety with my pregnancy with Katie was off the charts.
So whenever you were pregnant, so you found out you were pregnant with Katie, third pregnancy, and do you then let the Recurrent Pregnancy Loss team know you're pregnant?
Yeah, so I let them know. They said, right, start your progesterone.
Okay.
Which I duly did. And then they arrange a scan for around about 6 weeks, I think, is probably the earliest you can reliably see a heartbeat without having to call you back and, you know, mess around like that. So I think and then I had a scan every 2 weeks. That's
really helpful, isn't it, for man? It is helpful and it isn't, because it is also anxiety invoking, but
it's the lesser of two evils.
Yeah. I think it is the lesser of two evils. So you found out you were pregnant at what stage then with Katie? So how long did you have to wait for the scan? Yeah, that's a long wait, isn't it?
I was one of these crazy ladies, right, who had bought about
most of us are, Emma.
20 pregnancy tests. Yeah, and probably took 2 a day until the scan.
Checking to see if it was getting darker and darker.
Yeah, I was testing before my period didn't turn up. You know, I probably test from about 7 days after ovulation.
Yeah.
So, which I can't recommend.
No.
But I think we all do.
But we all do it. We all go down that rabbit hole. If it's not multiple ovulation tests that we're doing, it's multiple pregnancy tests.
Yeah. I mean, if I never have to pay in another stick again, I'll be happy.
Yeah.
You know, but so I found out probably at about 4 weeks.
Yeah. Right. So you've openly said, right, that some of your symptoms around your anxiety coming up to scans, IBS, any other symptoms around, how did that present for you? Because obviously it was quite crippling for you.
Yeah. Very poor sleep the night before. Yeah. Would have been waking up very tearful. Tight chest, sweating. I would have been sweating before a scan, to the point where I would have to apologise. I'm really sorry. I'm really sweaty. Yeah. Poor appetite, just all of those things. And I actually remember before one of my early pregnancy scans, when I was pregnant with Sophie, who's my youngest, I dinged somebody's car when I was out driving because I was so
past
distracted.
yourself. Yeah.
It was the morning of the scan and I was just so past myself. I dinged somebody's car. Obviously, I stopped, by the way, and gave them my insurance details. But
Good.
Just
disclaimer.
But yeah, I mean, I was
Past yourself.
awful.
I remember. So after we had Tori, we were pregnant again for the fourth, which was, we have 2 boys, and that was our 4th pregnancy. And I was going to Antrim Hospital for my scan, and it was the early pregnancy scan at 6 weeks. And I remember being so past myself that I actually drove past. So if you're coming from the north up to Antrim Hospital, the next turn off is like a way on up the M2, and I completely missed because I was telling myself, I'm calm, I'm okay, I'm a counsellor, I know how to deal with this. Nah, I was completely past myself, and that anxiety can be extremely crippling.
Yeah.
So how did you deal with that? How did you, I'm not going to say get over the anxiety because I don't think you ever really do, but how did you manage it?
I don't think I did. I think I just had to see it through.
Yeah.
The time will pass. I think I just had to tell myself, in 3 hours' time, you will know either way.
Yeah.
The time will come whether you want it to or not. You will be told the outcome of that pregnancy. And it will be what you want to hear or it won't be. And you're just going to have to get yourself through to that point until then. So I would use a lot of distraction techniques. I am not very good at meditation, mindfulness. I'm not good at it.
A busy mind. Yeah.
No. So I would just have to keep myself busy.
Yeah.
Give myself something to do, whether it was go out for a run or, I don't know, just distract. And I would say to my husband, I'm so anxious, and he was too, he was very anxious too.
Yeah, and sometimes the daddies are forgotten about a bit in this process, and we have to understand that Neil has went through all of this as well, and probably him on the sideline being really anxious for what was to come for himself, but also for you and how you were going to be.
Yeah.
It has to be quite difficult. So was there any point in Katie's pregnancy where you were feeling, right, I might be able to get a wee bit excited here now?
Very odd occasions, I have to say, during a lot of Katie's pregnancy. As it gets easier as it goes on.
Yeah.
For someone who's only ever experienced first trimester losses, that's obviously different for different people. So when I started to feel them move, in some ways that helped. In other ways, then I was hyper about monitoring movements, and would really panic if I hadn't felt them the way I felt I should have done. So with Katie, really, I didn't believe everything was going to be okay until she delivered. Even during my labour, I was convinced it was going to go wrong, and I remember saying to my midwife, is my baby going to die? And the midwife was like, what? No. Things, it was complicated anyway, but it wasn't any, we weren't worried about that. But
that's what was in your head going in to deliver her.
So with Katie, no. It was very difficult.
And how was your delivery with Katie?
Not great. I would have loved I was booked for an elective section for maternal choice, is the fancy phrase. AKA, I was too scared to go into labour and I didn't want anything to do with that. So,
and was that always the plan?
No, I hummed and had. So I went to an appointment and I said, I'm not going a week more than term.
Yeah.
So you may induce me at a 40+7.
Yeah.
Okay, fine. I'm not going beyond term. So you may induce me at term. The obstetrician's like, right, okay. And then I was, no, just can you, I want an elective cesarean at 39 weeks. Right, okay. So I went into the clinic, got my date for my section. She said, right, hop up, scan you, let's see what's going on here. And she said, your waters have gone. Your waters have been leaking. And I had, the second time I felt really stupid, I had no idea. So I was admitted, told I wouldn't get a cesarean. This was on the Thursday until Tuesday. And I thought, I'm not sitting on this ward. getting an infection. So I said, well, you're going to have to induce me then, aren't you? And so I just had to suck it up and laboured for a long time and got to 9 centimetres, and then I got septic. I got a womb infection, and they had to stop, the drip, and I didn't fully dilate, so I just had to have an emergency cesarean.
And you know what, Emma, like, yes, I think it's amazing that you knew to speak up for yourself, and you knew, like, that things weren't right. Like, what is the alternative there? Like, obviously those doctors listened to you because they knew that you knew your stuff. Is the option there for mothers to say, right, well, I want to be induced at this point, or I want to be?
I absolutely think there's the option to have the discussion.
Yeah.
Not many obstetricians will willingly let you go beyond 40+7 anyway now, just because of the change in guidance, and then especially if you're older. So I never had any pushback, to be honest. It was always just a discussion. And
you see, right, so at that point where they'd realised that your waters were starting to leak, was that an arranged appointment?
That was an appointment that I had just been booked to go to, just by chance.
Just by chance.
It was a growth scan.
Yeah.
And
things could have looked very differently.
I know. And that still gives me the fear, thinking about it.
Yeah.
And that really, when I was pregnant with Sophie, I was up at MAU saying, I think I'm leaking.
Yeah, the fear was there.
Yeah.
And you know what? Like, there are stats out there around, like, PTSD and stuff with people who have experienced, like, birth trauma or anything to do with birth, and also trauma in relation to previous pregnancies. Like, so there has been a lot going on for you, Emma. So Katie arrived.
Yeah.
Everything was great. And she's just a 3-year-old now. That's a ball of fun and keeping her mummy really busy.
Yeah.
So was the plan to have one, or were we wanting a bigger family, or what was the plan?
The plan was for 2, always for 2. So once we got round to having recovered from Katie and the sleepless nights and stuff, we thought, and the memory, the trauma fades somewhat,
Yeah.
You think, right, okay, let's start trying again. But I was always like, oh God, I'm gonna, it's not that, I kind of hoped that things would maybe have reset by having Katie.
Yeah.
And my risk of miscarriage would be lower.
Yeah.
But that, I don't think that's that. Well, it isn't, because I spoke to my doctor about it, and he said it doesn't work like that. So I was like, oh, okay. So yeah, we started trying again, and again got pregnant quite quickly. And allowed myself to be, I wasn't as anxious. I think because I'd had Katie, I thought, my body can do this.
Yeah.
So got pregnant, contacted my clinic, got up for a scan. Now, this is where my memory's really fuzzy. I think the first scan was okay, although I was measuring a wee bit behind, which I always do for some reason. First scan was fine at 6 weeks heartbeat. So went back at 8 weeks, and I think I'd been having a wee bit of staining, maybe a wee tiny bit of bleeding, but nothing to write home about, maybe, I don't know. And at 8 weeks, there was no heartbeat. I think he said it looked like it had stopped at 7 again. So I just thought, again?
Like,
why is this happening to me? What is wrong with me?
Yeah, and you blame yourself, and you start to hate yourself, and you go down
why
a rabbit hole.
Why is my body doing this to me?
And I imagine for you, Emma, the rest of us go down a rabbit hole of Google searches. You're probably going down the rabbit hole of medical journals and
both.
Both.
I mean, I'm not above a
good Google search
scroll. I was dreadful for Googling. And I was reading medical journals, and then being that probably irritating patient and being like, I've read about this, but also reading Facebook groups, forums. Very quickly learned that it probably wasn't that great for my mental health.
Yeah.
So didn't. but yeah, then so I had medical management again, and actually because it was my third, it
You
got
were
sent
still
for
under the
yeah, and it got sent for genetics.
Okay.
And there was quite a long wee wait for that to come back, a couple of months maybe. So we just paused, trying until we knew. And actually that there was genetic abnormalities that would never have reached term.
Okay.
Which I found very, actually very comforting. Not comforting.
To know what had happened.
Yeah.
Whereas the first 2 times, you weren't getting that.
Didn't have a clue. They could have been genetically abnormal, but we just
And is
didn't
that
know.
because you were under the care of a different?
No, I
doctor,
think
or
they only
just-
send the third. I think
Okay.
they only send the third, so they don't send earlier tissue. But to have that blame removed was really liberating.
Yeah.
That wasn't my fault.
It wasn't the run. It
No.
wasn't the coffee. Yeah.
Exactly. It's not my stupid womb, whatever it's doing.
Yeah, I'm not broken.
Exactly. So that really gave me closure on that. So that was emotionally still very difficult. But that did help me move on a wee bit from it.
Yeah. So it has to have been quite difficult then too, Emma. Like, at what age was Katie at this point?
About, I don't know, she was 2, maybe just shy of 2.
Like, so it's something that I always say, I always call the mummy mask. So you're putting on this mask for Katie because you don't want her to see you upset, but really,
it's really
you're
hard.
broken.
It was really hard.
Yeah.
And I think then as well, I knew what each one of these little pregnancies could turn into.
Yeah.
It was this fab little being that just lights your life up. And I thought, I really want another one of those. And, when you lose that potential for life, is really difficult.
Yeah. Right. So so you had paused at that point from trying because like you were waiting on results and stuff coming back. And then when did you decide to try again?
So once we found out the genetics were normal, we just thought, right, okay. And it took a wee bit longer. It was a handful of months, and I got pregnant with Sophie. And kind of similar, like no real excitement. Me and Neil were like, here we go again.
Yeah.
Well, buckle up.
And this is something that I always say, you see, for someone who has especially lost their first pregnancy, you don't ever get that excitement back.
Oh,
I don't
awful.
think of pregnancy again.
No.
Like, pregnancy becomes something that is just pure and utter anxiety, doesn't it? Like, I know, like, we had our 2 boys, obviously, before we'd lost. And if there's ever an at least in a story,
got that
I am so
experience.
glad that I had the naivety of pregnancy with Max and Mason, because it was just lovely. And in a way, I was a moan, I was a grouch, I looked like a ball because I was as broad as I was tall, and I complained every day through it. Whereas like now I know so much more, and like it was never on my radar. Whenever I was told, because I was on my own in Causeway Hospital, that we'd lost Tori, that there was no heartbeat, I remember actually thinking, Selena, you were so arrogant coming into this appointment. And I was coming into an appointment, I've had 2 babies, I'm going to be grand, I just need to get back to work here, like they're keeping me far too long.
I know.
And then your world just stops.
You feel so naive, don't you?
You really
afterwards?
do. Like, you feel so naive, and you think, like you said earlier, this is something that happens to other people.
Yeah.
And you don't think it ever is going to happen to you. And I think it's something that we're not educated enough about it, probably at school. I don't know about you, but my education coming through school, even like primary school, you're used to like the prince and princess stories where everybody has a happy ending and has babies. And then you go into secondary school and you're told, well,
Try not to get pregnant.
Don't be having sex because you'll get pregnant.
Yeah.
And then we also then know that, like, now I know I work with so many people, it doesn't just happen like that.
No.
It doesn't. Like, so you waited a while. How long then did we wait until we got pregnant with Sophie?
I think we got the results at some point in January, maybe, and No, it actually wasn't that long. I found out I was pregnant just before Katie's second birthday in March. So it wasn't that long, actually.
But it probably felt long.
Well, I miscarried in the November. So it was November through to March. It felt long because by that stage I was 38, nearly 39. And I thought, I need to crack on here.
Did you have an age that you would stop trying?
Non-age. But when I got pregnant with Sophie, I thought, this is my last ditch attempt. I cannot and will not put myself through this again. If this ends in miscarriage, that's it.
Because, Emma, and I think if people that are listening will completely get this, life goes on hold.
Yeah.
While you're trying to have a baby.
Can't life
holidays. No holidays because I might be pregnant. Can't go to that wedding because I could be pregnant and not be drinking and not be able to tell people. Can't go to the hen party because people will be asking, why is she not drinking?
Even your career.
Oh my goodness.
I'm thinking, hypothetically speaking, well, I didn't want a new job, but I can't start a new job or take on a new role because what if I'm pregnant? Everything goes on hold.
Everything does, and that is, I think that's where things can become very, very hard. I know for us, we went through a period of a couple of years where we were continually trying and almost forgetting about what we had.
Yeah.
We had 2 perfectly healthy boys there that were full of life, and I was so wrapped up in this having to be pregnant that I was missing out. I was missing out on, not obviously I was there, but your head's somewhere else.
Oh, I get that, 100%.
Your head is. So we then tried again.
Yeah.
And got pregnant with Sophie. How was that pregnancy?
Sophie's pregnancy was okay. Obviously being pregnant with a toddler isn't easy, but in terms of anxiety, I had support. I had your support because obviously on a professional
and
level,
I'm just going to say,
disclaimer.
I'm just going to say, Emma, your pregnancy was like the longest pregnancy in history. I feel like Sophie's pregnancy was from a therapist point of view who was supporting you. I was like, every time I was speaking, she was like, please just make everything be okay. And this is, and I suppose from a professional point of view, you can't help but care about the woman that you support. And I will never forget the day that you sent me the picture of you and Sophie, and I was like, do you know what? That's what this is all about.
Whenever I couldn't wait to send you that photo.
I know. It was like,
oh
my word. And I still have it. And I'm like, oh, that just makes this work so meaningful whenever we get a mummy to that point again. And it can often be very difficult to even, there'll be people listening to this who I'll be like I know will be probably hating this story because you see people having their happy ending and it's not always easy. But I think what I would say to those people is, please take this as a wee bit of hope that it can happen, because your journey has not been easy. And like you were saying, at that stage, like for me, my cutoff was 40. Because I think for a woman, there's just something about that age, isn't there?
Can be.
But I'm glad that. So anyway, the pregnancy, I'm glad that everything worked out with Sophie. But the pregnancy with her, you had more support around you.
More support. I resolved myself to enjoy it more. I was like,
and that wasn't easy for you.
Enjoy that more. This more if it kills you. Because I didn't enjoy Katie's pregnancy because I was so anxious. I thought, this is my last time I will be pregnant, regardless of the outcome. I need to practice a wee bit of gratitude and hope against hope that everything will be okay. And on the days that I can't, that's all right. But for the days that I do allow myself to feel hope, to really revel in that, and enjoy it. So, of course, there were lots of moments. I mean, I'll tell you this story for an example. We had booked, so after my third miscarriage, I was fed up putting off booking holidays, etc. And I thought, stuff it. I really wanted to take Katie to the Outer Hebrides in Scotland because that's where her dad's dad is, or her grand is from, right? So we thought, right.
At what stage were you pregnant at this point? by the
So
way?
I wasn't pregnant at this point
Okay.
with Sophie. It was after my miscarriage, but before I got pregnant again.
Okay.
So we arranged to go that summer to the Outer Hebrides, which is like islands off the top of Scotland, like, you know, really far away, essentially. So it rolled round and I was 28 weeks pregnant at this point and exhausted, and we were, you know, this journey up to the Outer Hebrides, and we were on this island, and I was obviously Googling, like, what is the obstetric care like in this place? And it was like one midwife for 3 islands. And
I remember you telling me this
God,
in a session.
if you have to have obstetric care, you need to be like choppered to the mainland and all this. And I was like, nice one, Emma. For
Good call,
someone
Emma.
like, as a medic who's already paranoid about the worst case scenario, and plus with a history of loss, I was like, what are you on? Anyway, we went, and the last night, before we were going to travel back to the mainland, I woke up at midnight and was lying there, and Sophie was a very active baby, and couldn't feel her kick, and I lay there for nearly an hour, and I was like, it probably wasn't an hour, but it felt like a long time. And I thought, I actually started to Google, like, what's going to happen to me if my baby's died? Am I going to have to deliver on North Uist, where there is only one midwife? I have a toddler here, and my husband, this isn't where we're from. And I worked myself up into
Such a frenzy.
Oh my gosh, like, so got up, did the usual, had a few biscuits and a drink and sat there and cried. And then she woke up, obviously, and I was like,
The relief.
Piss him, I can't believe you put me through this. But also, I don't think I slept until about 5 a.m. that night, you know, just from the adrenaline. And then the night before my planned cesarean, I had an elective cesarean with Sophie. Obviously, the night before, you're thinking, I'm going to wash my hair, have a nice dinner. My mum came over so she could be there for Katie the next day. I had my hair washed, and I just settled down maybe to get a wee bit of EastEnders in. And I thought, she's not really moving right. I'm not really happy with her movements. I thought, Emma, why do you do this? Why do you do this to yourself? And I sat there and I thought, I'm not going to be able to go to sleep without having this checked. So, but I was so annoyed at myself. I thought, this is your anxiety, and I knew it was. But I phoned MAU, and they were amazing. I went straight in. They took me straight away. Of course, as soon as you get the CTG on, she wakes up and it makes a liar of you. Mortified.
But you'd rather have that, though,
of course,
than not go.
Of course. So there was the night before my planned cesarean, 11 o'clock at night. I'm sitting there thinking, I should be in bed, getting the last full night's sleep I'm going to have in months. And here I am, sitting here.
Still not had a full night's sleep?
No. So...
But she arrived safely.
Yeah.
Well, that's the main thing.
God.
Right. So in your role, this is probably going to be my last question to you. In your role as a GP in Northern Ireland, what do you believe? Is there misunderstanding in your patients as to the extent of what you can do for someone who has experienced maybe recurrent pregnancy loss, or is there certain things that GPs can do to help patients? Like, is there tests that they can be... Say I was a mummy sitting at home who has had maybe 3 recurrent losses. What can they expect from their GP?
So... if you have had 3, recurrent losses, you should be being referred to a recurrent miscarriage clinic if that's what you want. And I just think a lot of women don't realise that, and we do have them in Northern Ireland. The waiting lists are atrocious, but they are there. So you should be asking for a referral. I think before that, and if you're 35 and if a 2 or more, referral as well. The grey area is before that, and that's when you're really relying on maybe your individual GP's knowledge on miscarriage, because we're generalists. We all have different areas of interest, or maybe areas where we've had more training in versus others. So, for example, hypothetically speaking, some GPs are really, really good at kids health, pediatrics, but maybe are less confident with certain other, and that's just the way it is because we all get different training. But for me, for my patients, because I've been there and I've done an obscene amount of reading about it because I've been the patient, I would certainly be offering them a thyroid function check, just baseline bloods with thyroid, you know, because if their thyroid's abnormal, that's an easy fix. And you don't need to, a GP can do that, you know. I think in terms of hormone levels, and there's a lot of chat out there about progesterone levels and different parts of your cycle, do not get bogged down with that. And as a GP, I wouldn't be doing that, you know, that would be beyond my remit.
I think that's the thing as well. Like, we go to the GP expecting sometimes all the answers, and you just can't give it.
We can't. Yeah. We can't. And that's why we have specialists. That's why we can refer to secondary care. I would be expecting, and I would hope that you would have support, advice about taking time off work, returning to work, how to access psychological help if you're struggling. You know, I try to, these are the patients I have boundless empathy for. And when they phone me and they're having a miscarriage, I will do everything in my power as a GP to make that experience easier, even if it means just saying the right thing.
Yeah. And I think that's something that there probably needs to be a lot of training around.
Huge.
Maybe, like, I always think, as somebody who's not medically trained, you think sometimes that the likes of GPs are beyond, don't need training and things, but my own experience certainly is that the basics, like the empathy, the language that you're using, you know, I think there's a need out there. I mean, you've talked about this in the past, a need out there for training for GPs, for healthcare professionals of all sorts. Emma, thank you so much for coming on.
Thank you.
I hope it wasn't too bad for you.
No.
And as always, if anyone feels that they've been a wee bit triggered by today's episode, reach out to myself, Selena, at the whitebutterflyfoundation.co.uk. Thank you.
Thank you.